Welcome to the media briefing today. The doctors we have today are Dr. Albert Au, Principal Medical and Health Officer of the Center for Health Protection, and Dr. Lau Ka Him, Chief Manager of the HA. Now, Dr. Au, please tell us about the new cases. Members of the public and media friends, good afternoon. I will now report the cases added yesterday on the 7th of April by the CHP. Yesterday, there were a total of 1,227 cases identified on PCR test. 205 were confirmed by the HA, 400 by the Public Services Laboratory. The remaining 622 cases were identified by private laboratories. And also yesterday, a total of 1,265 cases were tested positive on RAT. The total number recorded yesterday was 2,492. So far in the fifth wave, we have recorded a total of 1.17396 million cases, with 737,306 cases tested positive on PCR, and the remaining 436,390 positive on RAT. Among the cases yesterday, 8 were imported. The remaining 2,484 cases were locally infected. Among the 8 imported cases, 3 were caught by the temporary holding center at the airport. 2 cases were arrivals from Canada on the CX-100 on the 6th of April. And 1 case arrived from Korea on the 7th of April via OZ745. The remaining cases were found in quarantine hotel. 3 cases were caught on the 4th day. They came from Hong Kong. They came to Hong Kong from Ireland, Germany, and Australia on the 4th of April. And there is a case which arrived in Hong Kong on the 2nd of April from Singapore, and also 1 case was from Singapore on the 1st of April, tested positive on day 7. In terms of genome sequencing, we have performed genome sequencing on 706 samples. 3 samples tested positive for L452R strains. Because of insufficient viral load, a full genome sequencing is cannot be performed to find out the actual sequencing. 2 cases were cases back in February. We believe them to be re-positive cases. Yesterday, 692 samples were tested negative for L452R, meaning that they are Omicron virus. The remaining 12 samples were unconfirmatory. We have no new care homes with outbreaks so far. 787 RCHEs had outbreaks or infections in the 5th wave. For RCHDs, there are 290. For care homes with reported outbreaks or infections, among them, 37 reported new cases yesterday involving 45 residents, and also 12 care homes for persons with disability with reported outbreaks also reported new cases yesterday involving 13 residents. For number of deaths, the cumulative number of deaths in the 5th wave is 8,430, an increase of 86 compared with yesterday. The fatality rate is 0.72%. The cases aged between 11 months to 112 years old. The median age is 86 years old, with 8 children and 323 deceased adults aged between 18 and 59, accounting for 3.8% of the total mortality. The remaining 8,097 deceased patients were above the age of 60, accounting for 96% of the total mortality. Among them, 5,979 deceased patients were aged above 80, accounting for 70.9%. One of the new reported deaths yesterday was reported by CUHK involving a 93-year-old male. On the 16th of March, he was tested positive on RAT. He was an elderly care home resident with chronic disease, including prostate cancer, high blood fat, and cardiac problem. On the 7th of April, he passed away. Medical officers concluded that he died with COVID. 74% of the death cases were unvaccinated. 14% only received one dose. Only 12% of the cases among the death received 2 doses or above. In terms of mortality, the difference, there is a huge difference between those who were vaccinated and those who were unvaccinated. For those who have completed vaccination, the mortality rate is much lower than those who were not. Overall speaking, for the unvaccinated, the mortality rate is at 2.87%. For those who have received 1 dose, 0.89%. Those who have received 2 doses, the mortality rate would drop to 0.14%. For those who have received 3 doses, it is as low as 0.03%. Comparing those who have received 3 doses and those who were not, there is a 96 times difference. For those aged above 80, if they were unvaccinated, the mortality rate is as high as 15.68%. With 1 dose, it would drop to 6.11%. With 2 doses, a even further drop to 3.47%. For 3 doses, it is as low as 1.07%. The mortality rate difference between those aged above 80 with 3 doses and no doses, there is a 50 times difference. Now, Talal, please. Good afternoon. There are 9,503 confirmed patients receiving treatments in public hospitals, North Lantau Infection Control Center, our own Infection Control Center, and the AEWE Community Treatment Center. Last night, we reported another 9 critical patients, 11 serious patients. We have 68 critical patients in ICU. As at 0 a.m. today, in the past 24 hours, 70 patients tested positive with the virus passed away, being 37 males and 33 females, aged between 45 and 101 years. Among the patients who passed away yesterday, 31 were from care homes. 36 were unvaccinated. 18 received 1 dose. So 54 patients were not fully vaccinated, accounting for 77%. 15 patients received 2 doses. 1 patient received 3 doses. 67 patients aged above 65. I would like to report 2 younger patients who passed away yesterday. One was a 45-year-old patient. The patient has hepatitis because of the drinking habit. On the 14th of March, the patient complains of peritoneal problem, gallbladder problem, as well as breathing difficulty. The patient approached the Queen Elizabeth Hospital A&E. He had a coagulation issue with his blood. The situation upon admission was bad, and he was found to be carrying the virus. On the 7th, that is yesterday, he passed away.
Another patient, deceased patient, 60-year-old, he suffered from lung cancer, which metastasized to other parts of the body, including the chest and bones. Yesterday, he turned up at the A&E. On the 6th. He turned on at the A&E on 6th, nighttime, suffering from shortness of breath, coughing spells, and blood in the films. He turned up at night when he was admitted to the ward. It was early hours in the morning. And yesterday, he was under treatment in the ward. And the condition deteriorated because of the lung cancer, and the health was not in good shape. And in the evening yesterday, said he passed away. Because of the time lag, we submitted the figures between 4th of March and April 6th. 15 patients passed away, 5 males, 10 females, ranging in age between 73 and 107. 1,510 patients have recovered and been discharged. 6 patients tested positive upon admission screening. 10 co-patients were listed as close contacts. 20,876 staff members have been infected. 19,175 have been back to their posts. Right, and I'll throw the floor open for questions. Please wait for the mic and identify the organization you represent. A gentleman in blue over there, please. TVB. A question about the cases you mentioned, the CUHK Medical Center. Can you be more specific about the male patient, any vaccination record, and how his condition deteriorated? And Dr. Lau mentioned the 45-year-old case. Can you be more specific about the vaccination record? Did he get infected in hospital? Today we're starting with the mass testing on RAT. How many positive declarations have you received so far, and how many more compared with yesterday? And also the 24-hour hotline, 818-36119, how many people have called through? And also the utilization of the isolation center. Now with this mass testing starting, there may be more COVID-positive cases. Do you think there would be more admission as a result of this mass testing? Right, the first question is about the CUHK Medical Center, the deceased case. A 93-year-old male from a care home. On March 16, he was confirmed with COVID. He's a chronically ill patient. He tested positive for RAT on March 16th and March 29th. He was transferred from PMH to CUHK Medical Center. He was suffering from prostate cancer, high blood pressure, hyperlipidemia, and heart condition. And on the 7th of April, he passed away at the CUHK Medical Center. And also the RAT self-testing. We are encouraging the members of the public to conduct self-testing for 3 days, starting from today. If one tests positive, he or she should declare themselves on the platform. And we are receiving some positive cases progressively. We are still collating the numbers, and the positive cases have increased. As to the precise number, we will not be sure until much later today. I also understand now this exercise only started today. Some did it this morning. Maybe they haven't quite completed the uploading process, so we don't have the precise number for the time being. However, we encourage the members of the public to spend these 3 days conducting the RAT so that we can pick up all these silent carriers. If there are callers coming through the hotline, we will be following up. And if they can log on the web, we would ask them to declare online. If they need help, we would jot down their information and arrange for the supplies to be made available to them, and also arrange for them to be sent to isolation centers. The capacity of the isolation facilities is sufficient to cater for the number of COVID-positive cases. As to the CUHK Medical Center, Dr. Au mentioned that he was admitted on the 16th of March for fever. He was a resident from a care home. His blood oxygen dropped. He suffered from prostate cancer, and he was suspected to be suffering from colorectal cancer as well. He also had cardiac murmur and heart condition and anemia. Upon admission, we regulated or adjusted the medication, and he was admitted at CUHK Medical Center in stable condition. And in accordance with the conditions, the patient was given the appropriate treatment. I don't have the medical record from the hospital, although these patients suffer from chronic diseases, including cancer, and that put his life at risk. For the 45-year-old patient, as we mentioned, he has a long-term drinking problem. He's suffering from cirrhosis. Upon admission, obviously, he suffered from shortness of breath upon admission. He also had some jaundice, and he had problem with blood coagulation. Upon admission, he was tested for COVID. The CT value was 32.9. It was pretty high. And we tested him for antibody. It was also high. It wasn't a recent infection. He had 2 doses of vaccines. Bear with me. Yes, he had 2 doses. The last dose was in September last year. Next, please. A lady at the back, please. News. Recently, the number of infection has been coming down, and in order to control the COVID, other than the mass testing today, are there any other means to snap the chains of transmission so that people can have their life back to normal? And yesterday afternoon, a new batch of mainland express came to Hong Kong to look at the COVID situation. And in terms of epidemiological investigation, like the monitoring of the crowd situation in public places.
Thank you for your questions. Concerning the developments of the epidemic in the past few days, the daily new infection numbers hovered around 2,000 and 3,000. It was quite stable. In the past 2 or 3 weeks, we have witnessed a persistent downward trend. So the epidemic is indeed easing. However, we still have several thousand of cases each day It means that we have transmission chains as well as invisible patients in the community. Without tests, we will never be able to find them out, and the daily contact with other people would sustain the infection, and it is impossible to snap the transmission chains if that's the case. So the key is for everyone to do a test in the coming days to find out if you are infected. If it is so, you can receive prompt treatment, isolation, and cut the transmission chain. And also, we rely on the public to adhere to the social distancing measures, including mask wearing. In the anti-epidemic service bags, there are some KN95 masks. When you go out next week and when you visit crowded places next week, do wear KN95 for better protection. And in the upcoming holidays, please refrain from social gatherings as well as cross-family gatherings. Please comply with the social distancing measures and avoid increasing infection risk because of active gatherings during the holidays. We hope that if everyone can continue to comply with social distancing measures, we can the epidemic will remain stable so that we can relax social distancing measures and resume in-person classes on the 21st of April. Concerning the mainland medical experts, we thank the central government for deploying yet another delegation to give us health advice. We will maintain close contact with the mainland experts. And we will exchange views and listen to their suggestions on epidemic control. And we will also share our epidemiological data and analyze the trend together. In terms of analysis, we base our analysis on numerous factors, including number of reported cases and also the positive rate at sample collection centers, sewage samples, universities studies, and also citizens' mobility record. And then we will take different measures. Hi, I'm from Mingpao Daily. About the RAT exercise, our survey finds out that 2/3 of the citizens will not cooperate, and also even if they do it, they don't think it is useful. And also some people say that even if they are tested positive, they will not report it because they have a pass at home. They don't want to be isolated, and they think isolation serves no purpose. They would rather take drugs at home. And also they don't know why the government chose the coming 3 days to do it. So how would you respond to these views? And about care homes, in the fifth wave, what is the accumulative number of care homes experiencing outbreaks? And also what's the percentage among the total number of care homes for elderly people and people with disabilities? And the HA mentioned the two deceased patients, age 45 and age 60, what were their genders, and what about the vaccination status of the 60-year-old deceased patient? Thank you for your questions. On the mass testing exercise, it is a voluntary exercise. The government has distributed anti-epidemic service bags to all households in Hong Kong containing RAT kits. We hope that within a short period of time, that is 3 days, every person in Hong Kong would do a RAT. Every day we have 2,000 to 3,000 cases. It shows that there must be invisible cases in the community. We want to find out all these cases within a short period of time so that we can take the next steps, including isolation and also home quarantine for household members. That would be an effective means to find out all the silent cases in the community and cut the transmission chain. If you do it after the coming 3 days, it won't serve that purpose, because the patients can continue to roam free in the community, and the transmission chains will not end. It is on a voluntary basis. By reporting your infection on the platform, it serves two purposes. First, it will give us a snapshot of the infection situation. Secondly, the status of the infected patients would be entered into our computer system, and it would serve other purposes, for example, vaccination. And also for patients with serious symptoms, they would be hospitalized. And also for high-risk people, there is a high chance they would develop complications after infection, so they would be sent to isolation centers for monitoring. For example, elderly people aged 70 or above, and children aged under 5, as well as those with chronic disease and those immunocompromised people. And also we would assess whether the home environment is suitable for home isolation. If so, we would allow the patients to isolate at home. If there are high-risk household members at home, the outcome would be worse if they are infected, so it would not be suitable for the patients to isolate at home. Same for home environments with no separate toilets and bedrooms. So we urge confirmed patients to fill out the online questionnaire for us to make arrangements. For care homes, as of today, the cumulative number of care homes in the fifth wave is 787 with care homes, accounting for 98% of RCHEs. For RCHDs, 290 care homes has seen outbreaks, accounting for 97% of the total number. In terms of residents, for RCHEs, around 39,100 cases were recorded. For RCHDs, there were some 9,800 cases involving residents. Some care homes are reporting the backlog to us, so the number may be higher. The two relatively younger disease patients, first the 45-year-old female, that's a female. Like I said, she had psychosis. She received 2 doses of 2 jabs. The last time she received a dose was in September last year. The 60-year-old patient was a male with lung cancer, which has metastasized. He received 3 jabs. The last jab was in February this year. Next question, please. The lady in black. Good afternoon, doctors. I'm from Orange News. About a mass testing exercise, Dr. Au said the scheme is on a voluntary basis. Does the CHP think that we can get an accurate picture of the infection situation in Hong Kong through the test? Experts projected that if 3 million people took part in the test, we will be able to find some 10,000 cases. So how many cases do you think we will find? And this morning, the government said those above the age of 60 would can book the 4th jab starting next week. So do you think we should have a universal 4th jab? Now, this morning, Professor Lau Yudong said on the radio program that the unvaccinated students should sit close to the window and can only do activities outside the classrooms. Do you think that is viable? Now about the CUHK's medical center, how many patients have been transferred from the public hospitals to the CUHK MC, and what are the ages and what is the criteria of transfer?
Thank you very much for your question. About the mass RAT testing, the more people taking part, the better. This may be of a voluntary nature, but if we have more participating, then it will serve the purpose of having a universal mass testing. It is a good idea for everyone to be taking part. And if more people are taking part, then it would be far more effective, because over these coming 3 days, we will be able to pick up all the silent carriers. If people don't take part, they may not be aware of their silent COVID status, and we may not be able to achieve the ultimate objective. So we would encourage everyone to do their bit and conduct the self-testing using the RAT kit that the government distributed to them, so that we can take public health measures upon their declaration. For the time being, though, I don't have any projection as to how many cases will be picked up, although the universities have some projection. It all depends on the size of the population taking part. The more people taking part, the better. So I would encourage people really to take part in this exercise. As to the fourth shot, the joint scientific committee and also the CE's expert panel have already announced their recommendation for those aged 60 and above to be given the fourth shot. If they have taken the third shot 4 or 3 months ago, they can do the fourth shot. The government announced this morning that these people can get the jab at the vaccination station or vaccination centers. They can get the same-day ticket for the fourth shot. And starting from next week, the online system will go live for booking. As to the general population, the scientific committee is of the view that for those with low immunity, they should have the fourth shot 3 months after the third one. In terms of our statistics, the mortality rate and also the vaccination figure, after 3 shots, it would be very effective against the risk of severe cases or even death. The scientific committee is examining the data from around the world, and they will make the recommendation as to whether there will be a need for the fourth shot. As to the class resumption, we have been in discussion with the Bureau, and we hope that the campuses will be a safe environment for the students to have a normal school life. For students above the age of 3, they can have Sinovac. Those above the age of 5, they can have BioNTech. For those who are unvaccinated, I would urge the parents to take their children for vaccination so that they will enjoy the protection that they need. As of 8 p.m., there are 24 patients who are transferred at the CUHK Medical Center. 16 are COVID-recovered patients. We will discuss the transfer condition. The patients have to be in stable condition, and we will talk about who will be suitable. Some of them are not COVID patients, and some may be in the public hospital for surgery or for recuperation. And convalescence and so on, we will discuss with the CUHK Medical Center for the right patients to be transferred. Gentleman over here, please. In media, a couple of questions for the HA about the Lok Ma Chau Loop Emergency Hospital. It's run by mainland medics. What role does the HA play in that hospital when you deploy? Will you be deploying staff to that hospital? And how would you divide up the work with the mainland medics? And who has the jurisdiction over that hospital? Is it the Hong Kong law or the mainland law that will be governing that hospital? It is heard that some people would like to go to that hospital but were rejected, or some hospital members, and they asked to show their green health code. There are 1,000 beds, isolation beds, in the Lok Ma Chau Loop Emergency Hospital for the COVID patients. We are in discussion with them as to under what circumstances the HA can be of assistance, like the operational cooperation and what sort of patients will be transferred over there for care. Much is being planned at the moment. There is a lot of discussions on the details. Now, it is happening within a very short time. It is up and running within a very short time, and the government has been leading us in this regard, and HA will be fully cooperating with that. For the details, by the time they are finalized, they will be announced. It would take a bit of time for the decision to be taken. This is a new emergency hospital, and how are we going to run it in the best way possible? By the time we have the relevant information, we'll bring the media up to date. Lady in white at the back, please. Cable TV, about the CUHK Medical Center case. Now, that patient is in an advanced age. Why was the patient transferred? Well, was the patient in stable condition? What about the vaccination record? And also a 60-year-old male, 3 vaccinations. What vaccines was he administered? CUHK Medical Center. Before transfer, the patient was in stable condition. Upon admission, the patient had fever and low blood oxygen. Treatment was given, including antibiotics and also some treatment for COVID. The condition became stable and the blood oxygen increased, and fever was gone. And there were other problems as well, like a post-date condition. It is suspected that the patient also had colorectal cancer, and it was not right for the patient to be transferred back to the care home. So before the transfer, we had some discussion. The patient was suitable for some palliative care because of cancer, and emergency bed was arranged. This is a common practice for in the acute ward. If the patients become stable, they would be sent to the convalescence hospital for the patients to nurse themselves back to health before they would be going back home or back to the care homes.
On the question about the patients who received the 3 doses, the first 2 doses were Sinovac, the third was BioNTech. Next question, the gentleman over there. Good afternoon, doctors. I'm from Now TV. A bit follow-up about the CUHK Medical Center's deceased patients. What's the vaccination record? And do we know his situation right before he died? Why did his situation deteriorated? And you said he had died with COVID. So will you pass the case on to the coroner's court? And about the mass testing exercise, Dr. Au said just now, the initial figure has gone up. So is that within your expectation? And how effective do you think it will be to help us know the situation? About the oral medication, the HA said there would be a platform for private doctors to register to get the oral medication. So can you give us some progress? On your second question about mass testing exercise, I call upon the public to do a test every day between 8th and 10th of April. It has just begun today. So the figure today I cannot tell us how effective it is. We have to wait until we have the reports. So before I left office, it seems that the number has gone up a bit compared than before. Still, we allow 2 days for infected patients to make a report. That is, if you are tested positive today, you may submit the results within 24 hours. So we'll closely monitor the situation. We urge the public, if you have tested positive, please report it to us so that we can make a follow-up arrangement, including identifying high-risk factors to see whether you should be admitted to an isolation or quarantine center. Even if you have to work, if you are tested positive, you should stay home for isolation, and your family members should undergo quarantine, and we will issue papers for sick leave proof. About the patients at the CUHK Medical Center, I don't have his vaccination record, so I'm not able to answer your question. About oral medication, as said yesterday, at the public hospitals, 25,400 patients have been prescribed one of the two medications. We are working together with the CHP and the Department of Health to enhance and optimize our computer system. Progress is good, and the platform will be up and running soon for private doctors to sign up for drugs. I understand that the government and the Department of Health will consult private doctors and send a letter to doctors concerning the arrangement. What about the situation of the patients in the CHK Medical Center? We don't have his medical record when after he was transferred to the CHK MC. So I don't know his situation in the medical center. However, it seems that the patient has multiple chronic diseases. For example, prostate cancer, suspected colorectal cancer, and heart disease, as well as irregular heart rhythms, as well as anemia. These may have affected his condition, but I can't answer you because I don't have the medical record there. The last question, the lady over there. Good afternoon, Hong Kong Economic Times. You said there is enough isolation capacity for RAT positive patients. So what's the number? Now the death rate has climbed back to 0.72%. So is that an alarm? And how would you comment on this level of death? In terms of oral medication, does the HA have any data concerning the clinical performance of the drugs? Which one of the oral medications perform better clinically? You said in the near future, drugs will be given to private doctors, but how soon? Now, patients can get drugs from private doctors. So what about infection control? Do you worried that COVID patients may be mixing with non-COVID patients at clinics? On your first question about isolation facilities, we have sufficient isolation facilities. They include makeshift hospitals and isolation facilities, as well as Penny's Bay and the AWE. Given the capacity and the utilization rate at present, we believe that there will be enough to cope with a sudden surge of patients. Through the 2 online platforms, we are collecting personal data and health conditions, as well as home environment conditions from patients, so that the CHP can judge whether a patient is suitable to isolate at home or at isolation facilities. So judging by the number, we think it will be sufficient, even if there is a hike in case number. About drugs, Dr. Lau, please. We have limited information at hand. Some 16,880 patients have been given molnupiravir. 8,538 patients were prescribed with Paxlovid. Concerning the clinical analysis, I don't have the information right now. However, according to frontline healthcare professionals, including infection experts and microbiologists, after taking the drugs, the symptoms would be put under control swiftly. From a swab test, it seems that the viral load would drop rather quickly. For suitable patients, for example, patients aged above 60 or those younger but are immunocompromised, or those who were not fully vaccinated or have drug allergy, then the 5 days after infection would be the golden period to seek help. Now, our designated clinics are operating 7 days a week. The utilization rate is not high, which means for patients who are infected with COVID and have symptoms, it should be very easy for them to book a consultation. All suitable patients would be prescribed with oral medication to lower the viral load and lower the risk of complications or even deaths. Lastly, about the mortality rate. The figure we have given you just now is not the death rate, strictly speaking. That is the case fatality rate. It shows the risk of death upon infection of COVID. That is 0.72%. We expect the number to climb even higher because after infection, some patients may pass away after a period of time. So the base number is the number of people infected, and the denominator is the number of people who pass away after infection. So the denominator will increase in time. So we expect the case fatality rates to increase in time, At present, the number is 0.72%. That is the end of the media briefing today. Thank you.